Good morning. This is Follow the Science Monday Morning COVID Update. I'm Dr. Paul Juarez. I'm professor and vice chair for research in the Department of Family and Community Medicine at Meharry Medical College and principal investigator of the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee SEAL. Today is Monday, October 18th, 2021. Today, I'm going to start by providing an update on COVID and COVID vaccine trends, both nationally and in Tennessee, as well as discuss upcoming COVID-related events. Next, I'm going to talk about what some of the experts are saying about what we can expect and talk about some of the activities that Tennessee SEAL is doing. Nationally, the daily average number of new COVID cases is down 22% for the past 14 days to under 84,000, while the number of hospitalizations and deaths are both down by 18%. Daily deaths are now down to 1,528 per day due to COVID nationally. In Tennessee, the number of new cases of COVID-19 are down by 39% over the past 14 days to 28 per 100,000 of the population. Tennessee now ranks 43rd among states for the rate per 100,000 of new COVID cases reported over the past 14 days. Similarly, hospitalizations due to COVID-19 are down 23%, and deaths are down to 38.3 per day. On the vaccine front, the percent of fully vaccinated persons has inched up to 46.7% over the past 14 days, while the percent that have received at least one vaccine is now 53.7% in Tennessee. Tennessee now ranks as the 8th lowest percent of population to be fully vaccinated. This remains deeply troubling, as it indicates because such a large percent of the population is not yet fully vaccinated that another surge in Tennessee remains possible. Counties identified as hotspots are primarily in the northeastern region of the state and include Scott, Campbell, Hancock, Union, and Greene counties. They are all tracking with between 51 and 86 cases per 100,000 of the population. In contrast, Shelby and Hardeman counties are reporting the lowest rates of reported cases of COVID, between 9 and 14 cases per 100,000. All are in West Tennessee. A cluster of counties in north central Tennessee are now mostly in the average range, between 21 and 25 cases per 100,000 of the population. Most of the remaining counties in the state are between 26 and 50 cases per 100,000 of the population. Counties with the highest vaccine rates continue to include Meigs, Loudoun, Knox, and Washington in East Tennessee, with over 55% of their population fully vaccinated. In Williamson, Maury, Davidson, and Madison counties in central Tennessee, again, all having vaccine rates of over 55%. On the national level, the FDA has approved a booster shot for both the Moderna and Johnson & Johnson vaccines. CDC is expected to announce a go-ahead by the end of the week for persons over 65, those with chronic conditions, and persons working in frontline jobs to receive a booster for both the Moderna and the Johnson & Johnson vaccine. There is no indication of when a booster may be available for other persons by any of the three vaccines. Second, last Friday, the FDA heard from scientists at the National Institutes of Health on the effectiveness of mixing different brands of vaccines. Of particular interest is a report of increased efficacy of a booster of the mRNA vaccine for persons who receive the J&J vaccine. The FDA is expected to address this in the coming weeks. But perhaps the most eagerly awaited decision will be on when vaccines will be made available for children 5 to 11 years of age. On October 7th, Pfizer and BioNTech asked federal regulators to authorize emergency use of their coronavirus vaccine for children ages 5 to 11. While it is not yet clear when the FDA will rule on this, it is expected to recommend approval of the vaccine for children in the next few weeks. Locally, on October 2nd, the Tennessee SEAL continues to work with community and vaccine partners to increase awareness and address questions about COVID and the COVID vaccine, as well as to work with community partners to provide testing and COVID vaccines. This past Saturday, Tennessee SEAL team was at the Hickory Hollow Mall in Antioch, and Cherokee Health, one of our West Tennessee partners, was at a community event in the Fraser community of Memphis. About 30 vaccines were provided at the Central Tennessee event, while over 40 surveys were administered at the Fraser event. This week, the Tennessee SEAL will begin spearheading a weekly coordinating committee meeting of vaccine providers and community partners across the state in an effort to gear up for the approval of the vaccine for children 5 to 11 years of age. This group presents a challenge with the ongoing politicization of vaccines among children. We will begin to meet to discuss strategies for how to reach children and their families and to coordinate efforts to expand our reach. So that's it for today. Until next week, this is Dr. Paul Juarez with Follow the Science, Monday morning COVID update. Be safe.